Thank you for joining us today. My name is Christine Hodgson. I'm a metastatic breast cancer patient and advocate, and I'm here today with Dr. Priya Kumthekar, and I am very excited to talk with her about all of the wonderful work she does, especially for patients living with brain metastasis. A little bit about Dr. Kumthekar. She is a neuro-oncologist from Northwestern University. She primarily treats brain tumors, but has a specific interest in metastatic disease to the brain from cancers like breast cancer. She leads multiple clinical trials, which we'll talk about a little bit later. And all these trials advance the field of neuro-oncology to improve care for patients. So Dr. Kumthekar, thank you so much for joining us today.
Thanks for having me.
The first question is just very simple. Not everybody might know what a neuro-oncologist is. Could you explain what you do specifically and how it relates to breast cancer?
Absolutely. So neuro-oncologist is almost exactly as it sounds. So we are interested in the treatment of patients with both primary brain tumors, so tumors that start in the brain, as well as secondary brain tumors, so tumors that start in the body and then go to the brain. And so that's where it relates to breast cancer, because we're often treating patients with breast cancer that then spreads to the brain and around in and around the brain, as breast cancer is one of the primary cancers that leads to brain metastases.
And I know that some cancer centers don't always involve neuro-oncologists when they're caring for their breast cancer, CNS disease, but it can depend on the hospital. Do you have any comments about that? Is that something that a patient should be concerned about?
No, I don't think that patients need to necessarily be concerned about not having a neuro-oncologist involved in their care. It's just an added dimension and an added specialty that can be quite helpful. Not all hospitals actually physically have a neuro-oncologist on site to be able to include in their care, but we're a pretty small network of doctors. As a specialty, we're quite small compared to, say, medical oncology or breast oncology. And so if there are questions about neuro-oncologists and neuro-oncologists in your area, we can often connect you with those folks because we're often connected in one network anyway.
That's great. And so we commonly hear the term brain metastasis. I think we've mentioned it already today. But there is this separate type of metastasis called leptomeningeal disease. And I was hoping you could explain to us what leptomeningeal disease is and how it differs from brain metastasis.
Yeah, so brain metastasis is pretty straightforward, right? It's metastasis that go to the brain itself. But what a lot of people don't know anatomically is that the brain and the spinal cord live in this fluid, right? It basically floats in this fluid, and that fluid is called cerebrospinal fluid. And so what leptomeningeal disease is essentially the involvement of cancer in that fluid. So basically it's the presence of cancer cells in your cerebrospinal fluid. The name of that space is called the subarachnoid space. I don't want to get too detailed on the anatomy, but I think just generally speaking, the way to think of leptomeningeal disease is cancer cells that are in the fluid that surround the brain and spinal cord.
I think that's an excellent explanation. I think many people, we often in the advocacy community hear people kind of using that term lepto, when in fact it might actually be brain metastasis. So I just think it's important to make that distinction. And I wanted to ask too, can patients present with both brain metastasis and leptomeningeal disease? Is that possible?
Absolutely. Similarly to having, two sets of metastases, let's say to liver and lung present at the same time, it's just the same concept except different anatomical spaces. So absolutely, you can have brain and leptomeningeal disease present at the same time, just like any other metastatic site.
Understood. Like you can have metastasis in your liver and you can have them in your brain. And for patients that are living with brain metastasis, is there a risk factor then of developing leptomeningeal disease, or is that unrelated?
So yeah, there is a little higher risk factor of developing leptomeningeal disease. We're still understanding the depths of that. And we do know that some subtypes are more likely to then go on to develop leptomeningeal disease. So it's really hard to target that exactly. Similarly, we know that patients with lung mets are at greater risk of, let's say, developing brain metastases, but we can't quite pinpoint who they are. And that's kind of the same analogy for brain to lepto. It's hard to say. And to complicate things further, you can have leptomeningeal disease alone without having brain metastases. So really, they're truly, separate anatomic compartments that you can get metastases in.